What if a computer could detect cancer earlier than a human doctor? What if your smartphone could predict a heart attack before you even felt chest pain? What if life-saving surgeries were being planned not by humans, but by algorithms? Sounds like science fiction, right? But this is not the future. It's happening now. Artificial intelligence is no longer a concept limited to tech labs or sci-fi movies. It's entered the operating rooms, the emergency departments, the diagnostic labs, and it's changing everything. From detecting diseases with stunning accuracy to managing hospital systems, AI is quietly revolutionizing modern medicine in ways we're only beginning to grasp. So how exactly is AI transforming healthcare? Is it just hype, or are we truly standing on the brink of a medical revolution? Can machines be trusted with decisions that affect human lives? And most importantly, what does this mean for you and your health? Let's explore how artificial intelligence is reshaping medicine and why it might just be the biggest breakthrough in healthcare history. Artificial intelligence, or AI, refers to the ability of machines to mimic human intelligence, like learning, reasoning, problem-solving, and even perception. In healthcare, that means everything from diagnosing diseases to analyzing scans, monitoring patients, predicting outcomes, and even providing treatment recommendations. It's fast, it's scalable, and in many cases, it's more accurate than traditional methods. Let's start with diagnostics, perhaps the most dramatic area of AI's impact. In the past, detecting diseases like cancer, Alzheimer's, or diabetic retinopathy required years of training, expensive tools, and a sharp eye. Today, AI algorithms can be trained on thousands, even millions, of medical images, enabling them to spot subtle patterns that even seasoned specialists might miss. For instance, AI systems developed by companies like Google Health have demonstrated the ability to detect breast cancer from mammograms with higher accuracy than human radiologists. In one study, AI reduced false positives by over 5% and false negatives by nearly 9%. That means fewer unnecessary biopsies and more lives saved through earlier, more accurate detection. In ophthalmology, AI tools are scanning retinal images to identify diabetic retinopathy, one of the leading causes of blindness, within seconds. In dermatology, AI apps can analyze photos of skin lesions to distinguish between benign moles and malignant melanoma. And in cardiology, AI-powered ECG analysis tools are predicting abnormal heart rhythms before they become dangerous. But AI isn't just analyzing images. It's reading medical records too. Natural language processing, NLP, systems can now scan through thousands of clinical notes, lab reports, and discharge summaries to identify potential misdiagnoses, suggest alternative treatments, or flag dangerous drug interactions. It's like having a tireless assistant who never sleeps and never forgets a detail. In hospitals, AI is being used to predict which patients are at risk of readmission, which ones might deteriorate overnight, or who may require intensive care before symptoms escalate. It's enabling truly proactive medicine, catching issues before they become emergencies. Now let's talk surgery. Yes, even the operating room isn't untouched by AI. Robotic surgery systems, like the Da Vinci surgical system, are already assisting surgeons in performing complex, minimally invasive procedures with unmatched precision. But add AI into the mix, and things get even more powerful. AI can assist in planning surgeries, simulating outcomes, and even guiding robotic arms during procedures in real time. Imagine a machine that can reference thousands of past surgeries in milliseconds and provide real-time suggestions to avoid complications. That's not just helpful, it could be life-saving. But the magic doesn't stop at diagnosis or surgery. AI is also revolutionizing drug discovery. Traditionally, developing a new drug takes over a decade and costs billions. But AI is changing that equation. By analyzing enormous data sets of molecular structures, genetic profiles, and disease pathways, AI systems can identify promising drug candidates in a fraction of a time. For example, companies like DeepMind and Benevolent AI have used AI to predict protein folding, a breakthrough that could transform treatments for diseases like Alzheimer's, Parkinson's, and cancer. In 2020, An AI-powered platform identified a potential drug for obsessive-compulsive disorder in just 12 months, a process that typically takes 5 years or more. And during the COVID-19 pandemic, AI helped track outbreaks, model virus spread, and accelerate vaccine development by identifying protein targets and simulating immune responses. AI is also transforming personalized medicine. Every person is biologically unique, and treatments that work for one might fail for another. AI helps tailor care to the individual by analyzing genetic data, lifestyle factors, and medical history to recommend personalized treatment plans. In oncology, this means matching patients to the most effective cancer therapies based on their tumor's genetic profile. In mental health, AI chatbots are offering 24/7 support for people with anxiety or depression, using natural language models to simulate therapy-like conversations. In developing countries and remote regions, AI is closing gaps in access to care. Mobile apps with built-in diagnostic AI are helping community health workers detect tuberculosis, malaria, or skin infections where doctors are scarce. AI-driven ultrasound tools are enabling midwives in rural Africa to monitor pregnancies without needing a radiologist. AI is also reducing burnout among healthcare providers. By automating administrative tasks like data entry, billing, and appointment scheduling, AI is freeing up doctors to focus on what they do best, caring for patients. Virtual scribes that transcribe and organize notes during consultations are already being used to reduce physician workload. But while AI's potential in healthcare is vast, it's not without challenges. One major concern is bias. AI systems are only as good as the data they're trained on. If that data is skewed, say, lacking diversity in race, gender, or geography, then the AI's recommendations might be biased too. That's dangerous, especially when lives are at stake. Then there's the question of privacy. With AI analyzing vast amounts of personal health data, who owns that data? How is it protected? Are patients fully aware of how their data is being used? AI could lead us into a new golden age of medicine, where healthcare is not only more advanced, but more humane. Imagine a world where a teenager in a rural village gets the same quality diagnosis as someone in a top-tier hospital, where cancer is caught early, heart attacks are prevented, and mental health support is always available, thanks to machines working tirelessly in the background. That world isn't a fantasy. It's on the horizon. The revolution is here. Thank you for watching. If you found this video insightful, don't forget to like, subscribe, and hit the notification bell for more deep dives into how technology is transforming our lives. Share this with someone who needs to hear about the future of healthcare. Until next time, stay curious, stay healthy, and keep learning.